to the Health, Human, and Social Services meeting. The first order of business is to approve last month's committee meeting minutes. Motion made by Supervisor McDevitt, second by Supervisor Bramer. All in favor?
Aye.
Opposed? Carried. We have Christy Sabo from the Office of Aging. Go right ahead, Christy, whenever you're ready.
Okay, I have 3 resolution requests. You'll notice that I did give you an amended agenda. I spoke to Chairman Sokol before the meeting to ask if I could present another resolution request. It just came up yesterday, so you'll see that on your new agenda. But the first is a resolution request form number 12, a request to fill a vacant position, a fillable position. It's at my Warrensburg meal site, which is located in Countryside. It has been approved by personnel, and I spoke to the county administrator yesterday, and it's approved by him as well.
Okay, motion made by Supervisor Frazier, second by Supervisor Stroh. All in favor?
Aye.
Opposed? Carried.
Okay, the next one is a miscellaneous request. What I'm requesting is the authorization to sign agreements that don't have any monetary obligation for the county. It seems like recently I've been getting a lot of requests to enter into more formalized agreements with, like, say, Glens Falls Hospital to participate in their cancer screening, or AHI in relation to DSRIP or to FIP. Things that, you know, aren't really, they're not asking for any money, but they are asking for a signature saying that, you know, we're willing to participate. And it would just be a lot easier and quicker if I didn't have to keep coming to committee for those things, or talking to the county attorney.
Have you always done that in the past? We needed a resolution to do that?
Yeah, or I would go to the county attorney and have her review the agreement and just make sure, because I wasn't going to sign anything myself,
Okay.
that somebody else didn't approve.
Yeah. Are you just looking for like an out of committee?
Yeah, just
type
like,
of thing?
just the ability. I mean, I would bring it to committee still and let you guys know that I entered into an agreement, or that I was partnering with a certain agency or entity, but just I wouldn't have to wait for resolutions to get them done.
Okay.
I have no problem with it, with one stipulation that you could communicate with us as you're kind of simultaneously kind of about to sign the agreement, so that we know about it.
Sure.
Okay? Yeah. So.
How about just like a group email?
Yeah, I was just
Yeah.
gonna say
Yeah.
that
Sure.
would be fine.
Is that okay?
Mhm.
Yeah, that's fine.
Supervisor Sieber?
And you said you'll still run that by the county attorney's office prior to signing?
Yeah, I usually send it to them, just to have them review it and make sure there's nothing that, you know, gives them pause.
Great.
Okay, so do you need a motion for that? We do? Okay. Motion made by Supervisor Simpson, second by Supervisor Vanslo. Any more discussion? All in favor?
Aye.
Opposed? Carried. Okay, and 3?
Okay, the last one is, every year I have to do a separate application to apply for New York Connect funding. This is, you might remember, I did one for New York Connect's expansion and enhancement previously this year. This is the actual original grant. We're in the 10th year of this, and while it's covered under my annual implementation plan, it is part of that funding. For some reason, they have a separate application page that needs to be signed, so it has to go before the chairman. And so I believe I need a separate resolution request for that. So that's what this is for. It's, as I said, it's year 10. It funds the New York Connects program, which is the single point of entry program for the county. It's what enables us to get funding as an aging and disability resource center. And it's 100% funded. There's no county match.
Okay, we like money.
Yeah.
Motion made by Supervisor Bramer, seconded by Supervisor Sieber. Any discussion? All in favor?
Aye.
Opposed? Carried.
Okay.
Anything else?
Going up to resolution request form number 20, I do have an agreement that I will be entering into with AHI as part of the DSRIP delivery system reform incentive payment plan. I have to think about it. And it's just basically I'm agreeing to participate with DSRIP to help further the goals.
AHI?
Adirondack Health Institute.
Oh, okay.
Mm-hmm. And Amy Bartlett she'd already reviewed that and said it's good to go, so.
Okay.
All right.
Anything else? Anything from the other supervisors? Okay, thank you.
All right, thanks a lot.
Have a
Good
nice
day.
Easter.
coming.
thinking.
Look who we have back.
Yeah. Hi, it's good to be back.
I don't.
Try it right now. Come on, do it. Thank you.
Not the whole thing, but I have parts of it. Thank you. Thank you. Going from all directions here.
Anti-bullying laws.
Somebody needs counsel.
Keep pointing over this way.
No, I don't know what to do.
Need a group counseling session.
Yes, I brought them.
Okay, well, welcome back, Maureen.
Well,
Good to
thank you
see you
very
back.
much. Thank you.
We'll turn it over to you. Why don't you go ahead and get us started?
Okay, our resolution request is to appoint members to the Warren County Youth Board for 2016. We have three, Supervisor Frank Thomas, Susan Schefter, and Rosie Lewis, who's one of the youth that we're going to have on our, youth board. We're always looking for youth to be able to, have them become involved in that process. So, that's the first thing.
We do a background check on Thomas? Okay, we need a motion, made by Supervisor Frazier, seconded by Supervisor Simpson. All in favor? Opposed? Carried. Okay.
Okay. Our second resolution request is a request to ratify the actions of the Chairman of the Board of Supervisors in executing the New York State Office of Children and Family Service Plan, our annual plan for 2016. It was just updating really the past plans because it was a five-year plan. So we just updated that and, the deadline came up while I was away and they had, Chairman Garrity sign that, so we're asking to have it ratified. Thank you.
Okay. Motion made by Supervisor Seaver, seconded by Supervisor Bramer. Any discussion? Supervisor Seaver?
Is there a way to just email that out? I'm sure not everyone wants that for their, Friday night reading. I would love to look at it.
We can get that to you, positive, and anyone else that wants it.
Okay, we have a motion and a second. All in favor?
I'm really
Aye.
Opposed? Carried. Item
Okay,
three.
the third one is we're going to request permission for one staff member to attend the 27th Annual New York State Foster Care and Adoption Conference in Albany, May 5th to the 7th, and the cost of the program is $190, and the person is coming back and forth and using one of the county cars, so.
Okay.
Make motion to approve.
Motion made by Supervisor Strauss, seconded by Supervisor Simpson. All in favor?
Aye.
Opposed? Carried.
The fourth request is for permission for one staff member to attend the 21st Annual New York State Child Abuse Prevention Conference in Albany, April 11th through the 13th. The cost of the program is $395.
Okay. Motion to get this on the floor made by Supervisor Vansville, seconded by Supervisor McDonald. Discussion?
I don't see the cost in the attachment.
She just put it on the front.
Oh, okay, okay.
It isn't, am I missing it?
Right on number 4, she said the cost of the program is
Oh, just,
$395.
okay. Is that all it needs to be? Okay, I'm sorry, we have a motion and a second. Okay, all in favor?
Aye.
Opposed? Carried.
Our fifth resolution request is to create and fill the position of intake clerk 7 in the Medicaid unit and request backfill and abolish the position of social welfare examiner number 34. Grade 8, step 1, salary was 32, and the employee number is there, 12 $661. Due to a resignation, this person is moving over to the probation department. So it's, a wonderful thing for that person. And we decided, the supervisor of the unit in Medicaid that this worker was, he thinks that, it would be more effective to have an intake clerk rather than a new, SWE come in. Because, that's just how it's going, and eventually, we all have to worry because our Medicaid unit is gonna go, so it's probably a good idea to drop this person down to an intake clerk, so, the position.
Okay, so abolishing it, though, we're getting rid of it completely, right? We won't,
Right, we,
won't be asking for it back at some
I
point?
do not believe we will be because, probably in 2 years, the state will take completely over for that part of Medicaid. We will still have to keep the chronic care unit, which is much more involved, and the state is in no hurry to get involved with that yet.
Okay. Okay, need a motion to get this on the floor, made by Supervisor Renslow, seconded by Supervisor Bramer. Any questions, or, all in favor?
Aye.
Opposed? Carried.
Okay, the next request is to create and fill 2 caseworkers positions, number 34 and 35, and request a backfill. And the rationale for this is, over the past couple of years, several caseworkers have been out on various extended leaves, making it difficult for the units to meet paperwork guidelines and, more importantly, to give optimum services to families on a consistent basis. The 2 floating positions would provide the necessary caseload coverage to the units in need. So right now, we're very high with cases in CPS, and we've gone through several maternity leaves there, and you can't just have somebody, temporarily come in because you have to have the New York State CPS training. So usually, when somebody goes out from that unit, we can't replace a person, and it puts a terrible burden on the people in the unit to do that. And, the other position at this moment, we have someone out on extended leave, and they've been out for, 6 months. We've looked for a temporary person, and we couldn't find anybody, and that was not working or willing to come in just temporarily. And so that has created a very big strain on the foster care unit. And we had, and it's been, for sometimes the other units have people like are out on leave and things, and it's been very difficult for caseworkers because the job is stressful enough, and then when you're adding a burden of more work, it just becomes overwhelming for some people. And it would be better to make it easier for people to do their job than harder and then start losing people. And it's to the point where some of the people are not even interested in overtime anymore because they need to have some break away from their duties, and they're all on call anyway, not at, one at a time for 24 hours CPS coverage, so it makes it very difficult for people in this very difficult job to kind of renew themselves when they're always have to be working.
Maureen, I see they're both federally funded, only 50% though?
50 and state 25%.
Oh, okay.
It's
I see.
how the form is, that it looks like that.
And I'm assuming I applaud you for creating these. Is it in your budget?
I'm gonna have Julie answer that question since she's my budget person.
One, definitely, because as Maureen mentioned, we have a position that is empty due to circumstances. So that one, we've definitely covered. The other one, I would have to see later on in the year. The way we're going, I feel we could probably end up covering the second one as well. We've had some positions that, as you know, it takes quite a long time to fill an empty position. I myself have had one empty for 4 months. So, that would pay for part of one, and you know, ongoing, there'll probably be more empty positions throughout the year. So I don't know if we could cover it 100%, we won't know till later on in the year. But at this time, we would not ask to increase our budget to cover these.
So
Move
it's-
it. Motion made by Supervisor Simpson, seconded by Supervisor Bramer. Any questions or?
So the net number to the county is, let's assume the worst of possibilities and we have to find the money. What's the net?
If we had to cover 100% of one position, we're looking at about $60,000 between salary and benefits. The county share of that would be 25%.
And we probably would save some by not having overtime
Exactly.
paid to our,
Exactly, overtime should go down based on,
We will always have a little overtime because of the on-call, and sometimes my caseworkers get stuck in court for longer periods of time, and they can't just walk out of court, so they're there till the end, so.
Supervisor Seaver, did you have your hand up?
No, I think you answered it. I just wondered if they reimburse federal or, benefits as well, and it sounds like
They
that
do.
75% goes towards benefits too.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried. Okay.
My turn?
Dee, you're up. Yes, I'm sorry.
Okay. The first item we have on the agenda is permission to reduce the hours for our account clerk number 3 from 24 hours a week to 20, and then permission to fill it due to termination. This overall would be a cost savings, just the county share of $1,351. And the reason I'm asking to reduce it is the past 2 individuals we've had in this position have called in frequently. So we've still been able to do the amount of work we need to with a reduced number of hours, so.
Very nice. Okay, motion by Supervisor Simpson, seconded by Supervisor Bramer. Any discussions? Okay, all in favor? Opposed? Carried.
On the back of the agenda is our overtime report, and it was updated for this past pay cycle. So it's changed from the last time that you got the agenda. Overall, we are still down just a little bit from last year, so we're within the right range at this point. I don't know if there's any questions on that.
Okay.
And then another item I just wanted to make you guys aware of, is that we will be asking, probably next committee meeting, to ask to replace one of our boilers for the building, which is what heats the building. We currently have 2. The end of last November, we started to have some issues with it. We were able to get it up and running, but we spent about $5,000, with having different services come in to, get it up to par. I think the new boiler should probably be around $20,000 to $25,000. Half of it is, covered by reimbursement, but it is something that I think we're gonna need, and that we should replace it before the next heating season. Unfortunately, we don't have the money in our budget this year to do it. We did last year, so I would be asking to borrow from the contingency fund.
We've got plenty in there.
is there any reason not to do it now?
Right now,
Pass it up to budget or whatever?
I think we do need to do it before the next budget season, because like I said, we spent $5,000 this year. We would probably have to spend that same amount this year, or last year, sorry. We'd have to spend the same amount this year to make sure that it was running for the next heating season. We have 2 boilers. One of them is original to the building, so late 1970s. The other one is about 10 years old, and this is the one we're gonna ask to replace. When BPI was working on it this past November, the whole bottom half is pretty much rusted.
The 10-year-old one?
Yes. Mhm. It's, one of the cheaper models. So they don't think that it's gonna last through a whole nother heating cycle as well. And I'd rather do a replacement during the summer when we don't necessarily need it than doing it in the fall when you could run into trouble with not having the necessary heat in the building.
It's up to the committee. If you guys wanna pass it now, we can pass it now.
I would think.
Frank, we can take some money, can't we? Yeah. Want to put a motion on the floor then, Mrs. Bramer?
Sure, yes.
Okay. Motion made by Supervisor Bramer,
Move that we purchase a new boiler for the.
seconded by Supervisor Vanslo. And this is for, we don't know the final figure yet? but-
No.
Okay.
We do have one quote from last year, so it could still be up a little bit more depending on what the bid process turns out. For just replacement of the boiler, it's about 18,000. And then to add the whole system into a propane system, so it's not heated by fuel oil, it's heated by propane, which will in the end be cheaper, it's about another 10,000. So we're looking at probably about 30,000 to get the new boiler and to change it over from a fuel oil to a propane system.
That's our total cost?
I don't know definite, depends on what we get for the bids,
Right, okay.
but I would think it
Okay,
wouldn't
so
be more than
to
that.
start the bid process, is that your motion, just to get?
Yes.
Okay, we have a motion and a second, any discussion? All in favor?
Aye.
Opposed? Carried? How did your party go? I could not make it, but was the
It
theme
went
night,
really well.
did it?
Yeah, all of the residents were there, we had a lot of staff members with their families, a lot of, family members of the residents came, and it was a lot of fun.
Nice.
Way too much food, but
Hmm.
definitely a lot of fun.
Good. Good to hear. Okay, Julie.
For both our revenue and budget for January and February, pretty much on target. I don't have any concerns at this time. And for our overtime, we're always trying to keep it down as much as possible. And it's looking pretty good compared to last year as well.
Anybody have any questions for Julie? Looking good? Okay, if nothing else, does anybody have any questions for social services? Okay, Pat's on the agenda, but actually at this time right now, maybe, now that you guys are back, Travis, do you mind, speaking on that issue right now that you, we discussed earlier?
Yes, I had a question. We're facing continuing expenses with Siemens of about $40,000 a month. The largest portion being the mortgage payment, which is, as Mr. Qualtrics said, $32,000 and change. He said that it was going to be, that he expected that to be reimbursed, but I can find absolutely no evidence that that will be the case. In addition, it seems from the treasurer's report that we got the other day that we're paying, we're continuing to pay the service fees to maintain that equipment to Siemens, and that's over $6,000 a month. And I guess we've been unsuccessful in trying to have centers take over that, because it would seem like that would be their responsibility, but I think they're clever enough to know that if you really look at these contracts, kind of between a rock and a hard place on that one. I'll explain that a little bit more. If you look at the contract, officially, Siemens has never allowed us to transfer ownership to centers, and because of that, we're still responsible, according to the contract, to operate and maintain and service this equipment. So, it doesn't seem logical, but it might be a legal trap that we're in. And then there's also a matter of about $650 a month, you know, very small portion of the $40,000, and that's the only one that I would agree with we should continue to pay. And I think that was discussed last month. So that, but my question is, you know, how long do we expect to be putting out close to $40,000 a month, and how can we get away from that eventually? Is there a plan? I don't have one.
Brian, are you familiar with it, or Paul, are you familiar?
Mr. Chairman, I would just say that, you know, this is being handled by outside counsel. There have been numerous discussions with members of the board, and I think that I would recommend that you talk with your outside counsel. He's going to be your best source of information regarding all of these matters. And certainly, I don't think you want to talk about it in public at this point.
Right. We'll talk to Larry, Travis.
Yeah. I mean, I don't know why you wouldn't want to talk about it in public, because the public's paying for it, but, you know, I'd like to, we've heard a lot of things from council. A lot of things seem to be conflicting. resolved.
Thank you, we'll look into that. Supervisor Brammer?
I would like to discuss it more if it's appropriate to go into executive session. I don't know what the particular parameters are for this scenario, but I would like to discuss what we might be able to learn from our outside counsel on the Siemens contracts.
Well, I think it would be helpful to have Larry here, though. I don't know if you were looking to do it today.
I
like
would
right
like to just quickly talk among the committee about what we would like to get from Larry.
Executive session item, though.
I think that's a public discussion.
Okay. I mean, so from my perspective, we've asked Larry like a year ago, or I don't know what the exact date was, about these contracts and what we can do from a litigation standpoint. And we know that Kate has looked into it, and that process is moving along, but I would like to know, like what Travis is saying, what is our plan, you know, setting aside whatever Kate may be doing or whatever we might be getting from someone else. We need our outside counsel, whoever that person may be, to give us some advice. And as far as I know, we don't have any legal memorandum or analysis from Mr. Pauschwitz on the contracts. I mean, he carried us through closing of the building and the nursing home itself.
Well, this honestly was just brought to my attention this morning. So, I mean, if we want, we can probably have Larry come to the next meeting, and then we can address some of these items.
I'd like to also ask a question. I mean, the issue of, I always thought as part of the contract that we had to have Siemens agreement to basically assign any rights and obligations of the cogeneration. So I'm confused as to how, and the nursing home is closed, but I just would like to know the status of where that lies, okay? Is that issue still up in the air?
Yes.
Okay.
Thank you.
Took the words out of my mouth, but I didn't. Supervisor Huber?
I want to direct my questions to our county attorney. I'm wondering, has there been a reimbursement payment yet received from Centers? I know there were a lot of questions about the bill that recently got sent out that was clarified. And I'd like to know if anybody could tell us if we did get payment, and then also, what's the status of whether they're going to continue with the maintenance contract or not?
My understanding is there was at least one reimbursement payment. I don't know. I don't know exactly how many reimbursement payments have been made this year. I am in the process. I started yesterday trying to figure out exactly where we stand on that. I know that bills have gone out, invoices have gone out, payments have been received. I don't know the exact status of what's been paid and what has not.
Can that just be conveyed to us in an email, or?
Absolutely.
I mean, and your question about the service contract, do you know if they're taking that over? Or is that
I know that-
something, a line item on our bill to them saying, pay for this?
I know that Larry has been trying to contact Centers for clarification on that issue, and he's not gotten a straight answer yet.
Maybe we can reach out to Larry. It might even be better if he came to the board meeting in April. Or, I'm sorry, yes, in April. Would that suit you guys well? Is that okay to have an executive at the big board meeting?
Sure.
Supervisor Brand?
Don't we have another committee date when we're all here? Is there a way for him to come in, even though it's just added on to that day?
Well, I was just thinking it would be great if all the supervisors were there. You mean just like a regular committee meeting?
Well, most of us.
Most of us are here now, but
Here anyway.
still, we do have
Board meeting.
absent people.
Okay.
I think the board meeting.
I was gonna say, I think the board meeting would be the appropriate
Okay,
place.
we'll reach out to Larry and do that then. Okay, thank you, ladies.
Thank you very much.
Maybe we need a night meeting. You think that'd be good?
Let's have a night meeting. Let's have some committee meetings during the day, that you can get to drive down. Then you can drive down again.
Yeah. Don't forget, I have the longest trip to make of anybody.
That's right.
with doing the boiler thing now?
I kinda did, I felt like we could have waited at least a couple of months. But I understand her point, because we just went through the process of changing, but I also think the figures will look better. We just went, well, we just changed over, changed from fuel oil to propane.
How high it is for
Well,
me.
you were kinda on top of it.
Yeah, I would have to sit on the edge to my seat.
No, I, what was I say, didn't
That's
you?
why you don't want to. And then also, we got the litigation.
Did, I remember that. Oh, well.
Are we making any payments?
Yeah.
Receiving
Did you
any
get started
money?
for our board meeting?
Anyway, I was just
Yeah,
thinking, I thought you were on top of the
Well,
bill.
last night, she had somebody repairing it, and we were working on,
We have to enforce our contract, right?
I don't know, this first time, this trip was working.
Okay, let's continue with our meeting here. We have public health up. Ms. Sauer, whenever you are ready.
Okay, first thing, would be, we'd like to request a resolution to renew the contract with the New York State Department of Health to allow us to continue to receive funding for our lead poisoning primary prevention grant. It's a multi-year period, which started back in October, but we just got the information in the amount of $23,001 per year. It's an ongoing grant, and usually we won't come back, unless they change the amount for 5 years.
That extra one helps. Jeez. Okay, we need a motion, made by Supervisor Frazier, seconded by Supervisor McDevitt, all right.
I just have a quick question about that. I mean, in looking at this grant and lead, have there ever been any examples in Warren County's history where we have found lead in the water in the county? That rises to a level of concern?
Not necessarily from a community standpoint, but in 1996, we had a kid with a 96 lead level, which is extremely high, that suffered consequences neurologically from that. So this program mainly focuses on children 0 to 6 and screening and testing for lead levels, and then following up should they be elevated. If they're elevated, there's household testing, water testing, soil testing, and that's done by the State Health Department. We collaborate with them.
Did you ever determine what the source was for this child that had this?
Definitely lead paint in the house. And for whatever reason, Warren County's never had a high morbidity for lead for children. Looking at our annual report, we really don't have that many over 15 or 20. There is no normal lead, but we like to see lead levels under 10 as preferred, and those are considered the kids that we'd rescreen the following year. Over 15, we do home investigation.
Does this grant include the testing of water systems throughout the community?
No.
No.
It basically is outreach and education to
I see.
providers, to families, to PTAs, to daycare providers.
We don't do, because not being full service, we don't oversee the water. And we have had a number of calls recently about water with all of the, information in the news. And NISAC does have a pretty intensive, study out there if you're interested to read. But we don't do water testing.
Thank you.
Okay, we have a motion and a second. All those in favor?
Aye.
Opposed? Carried.
Okay, moving on, still with the lead grant, we would like to request a resolution to amend the Warren County budget to accept our new grant is $1,095 more.
Okay. Motion made by Supervisor McDonald, second by Supervisor Vanzilo. All in favor?
Aye.
Opposed? Carried.
We would also like to request committee approval to allow Dan Durkee, our senior health educator and emergency preparedness coordinator, to attend the medical countermeasures mass dispensing lessons learned workshop at the State Preparedness Center at the United County Airport on April 6th. There's no charge, but it's one of the deliverables for our emergency preparedness grant, so the only cost will be tolls, and he's gonna go and come in a day, but we need to have, it's just not down the road, so I brought it for committee approval.
Okay, do we need to pass these in the, it's just for tolls. I mean, I thought we had,
Me?
Still approve it, it's not a resolution, it's just committee.
Okay.
Just committee
Oh, okay,
approval.
okay.
And that you still need to sign the sheet.
Still do, okay. We all good with it? Alright, we do need a motion and a second. Supervisor Bramer, second by Supervisor Simpson, all in favor?
Aye.
Opposed, carried.
We, would also like to request committee approval to allow Sandy Watson and Lindsey Graham to attend the annual breastfeeding education conference. Committee approval is, needed because the fee for the conference is over $100. It's 100% funded by the WIC grant.
Okay. Motion made by Supervisor Frazier, second by Supervisor Simpson, all in favor?
Aye.
Opposed, carried.
We would also hope to get committee approval. We've had 2 nurses resign for retirement, and because it's not always quick and easy to recruit them, I did have some conversation earlier this month with the administrator and Mr. Sokol to allow us to go ahead and post the positions, which I was lucky enough to get. I can't say I've had a whole lot of people responding, but we have had some responses. But, we're ready to go as soon as we can recruit people. So I guess at this point, we're looking for committee approval so that when we're lucky enough to get candidates, we go ahead and get them back.
A motion made by Supervisor McDonald, second by Supervisor Vanslo. All in favor?
Aye.
Opposed, carried.
Okay, moving on to more personnel issues. We, I've told you before, we have a supervising public health nurse that's out on long-term medical disability, so we would like to be able to create a temporary position to fill in for her. We've been piecing it together as best we can, but it's a full position. It really needs oversight. We can't let it go and slip, and it just needs to happen. So I did speak with the administrator, and I spoke with civil service. So they're saying that we can do that for a temporary 90-day.
Okay. Motion made by Supervisor Simpson, second by Supervisor Bramer. Any discussion on this?
Is that something I would go to personnel, or is that, if it gets approved here, how does that go?
Yeah, it does go to personnel, but I don't think it's not an item that we're gonna discuss, right? It's like at the...
Creating a position, no, it'll be an action item.
It will be an action? Okay. Okay, we have a motion and a second, all in favor?
Aye.
Opposed, carried.
Moving on to, pending things, we haven't, received any more parts for our Fiesta cars, since last month, so we're still waiting there. I will say that the staff at Neiman Shop has been very vigilant in calling and saying, we don't have it yet. So, that's kind of where we are there. Moving on to information for discussion, attachment number 1 is our monthly emergency preparedness, report. Nobody has questions there. We can move on to the status of referrals, which is pretty self-explanatory. It's been a little bit quiet lately. Things kind of ebb and flow, but compared to last month, we're better. If nobody has any questions, we can move on to, attachment number 6, under personnel issues. Did have some conversation with, the administrator and with Mr. Sokol regarding this. We'd like to be able to establish a per diem rate, for weekend and holidays of $40 an hour, and as you can see, basically what's happened is when we're down positions, our regular people have to work more weekends, and, really a lot more weekends. So we decided, or hoping that with this increase, we'll be able to utilize per diem rates that will be paid, commensurate to what the nurses would make, and we would still be able to, save a little money because we won't be paying them on call, and it will also keep our, full-time equivalent people from burning out. And, they do 12-day stretches, and that really doesn't work. And if they take days off during the week, that depletes our staff. So if we can do this, I think it will work. So I can read the whole thing, but I did send it to everybody.
Is everybody okay with this?
Mm-hmm.
A motion made by Supervisor Frazier, seconded by Supervisor Bieber. Any discussion? All in favor?
Aye.
Opposed? Carried.
And just to follow up, last month, I told you a little lie, but I didn't mean to tell you a lie. You told us when we were here that we did, at our survey, we did fine, and, that we would only be getting, weren't getting any deficiencies, only recommendations, and lo and behold, when we did receive our report, we had one, what they put down as a deficiency, which, was promptly corrected. But we had to build a little case around our medical waste, which Buildings and Grounds did in less than a day, and it's all done. We submitted our report, and they're very happy with it. And, they've sent it back that we're fine. And they also asked us to incorporate the word infection control as a specific, topic in our utilization review. So I'm thinking if that's all they could find, I'm still happy.
I built you up pretty big at the board meeting, too.
Sorry, well, I said I told you a lie, I didn't mean to. I also said we hadn't gotten the report. Okay, Tom, moving on to, expenditures and revenues.
Attachment number 2 is our current status as of March 18th for the financials. We're in the process of closing the February books and getting those closed so they're not reflected in revenue. Regarding the salaries, which is the bottom half of attachment number 2, we always like to show where we stand compared to last year. And you'll see that in regular salaries, because we have been down some nurses, and especially the one who's on a medical leave, our salaries are down $37,000. Overtime is down $2,300, and our part-time salaries are up because we're utilizing the per diems that we can to try to fill in those spots. We have a fairly good per diem pool right now, so that's working out well. Our next page, attachment number 3, is a comparison of this year to date to last year to date. This I labeled as updated because what we sent you is what I submitted last year, and I said that doesn't look right. It was a week later, and I really like to compare apples to apples, so I went and reprinted March 18th of 2015, so it's comparable. Payroll was still the same, there was no extra payroll. The big difference was in contractual, which is what I had guessed, because it didn't look right compared to, it depends on timing when things are posted, that's the unfortunate part. I could print something in the morning, and by 4 o'clock that afternoon they could have other, but I've already submitted my numbers. So I went back, and this is exactly as of a year ago, when I printed on March 18th. So you'll see that the personnel is everything that we said before with the overtime and part-time. Regarding contractual expenses, they were up or down by over almost $250,000 is our long-term care program we no longer have. We have one patient in there right now. The state has slowly closed that down. And the other big thing is, again, as I've said before, timing of payments, our preschool program. Last year at this time, we had paid over $400,000. And again, it's due to timing, and this year we paid like close to $200,000. So a big chunk of that really is the preschool program and just timing of getting bills in from the different places and getting those paid. Salaries, like we said, overall were 5.76% below last year, and our part-time salaries overall 11.23 above last year because again we're using the per diem. Benefits again correlate with the lower. The per diems don't get the benefits like full-time, so that's again why our employee benefits are down. And otherwise, where we are. We will be getting in, well, we have got it in March, it will be in April, our preschool where we can bill, which I know is a big thing, but that could be $500,000 to $1 million, depending on once we get all those reports. We'll have to get that to the state and get that billed. That'll all be in some closing of WIC program within the next month for the 2015 numbers.
Very good. Any questions on that?
That's all we have to use.
So have you heard anything about Sharon's done in April?
Done in April.
Have we found anybody yet?
I have several things in the hopper.
Good. I get it. Okay, anything else for public health? Motion to adjourn made by Supervisor McDevitt, second by Supervisor Brammer. All in favor?
Aye.
Opposed? Carried. Thank you.
Time for lunch. I think we can fit that in.
You got 45 minutes here?
Yeah.
Are you on?
I'm on for all afternoon. about, hey, here I am for the day. They don't even know,
No, it does, yeah, it's just that they're, you know, obviously when you're reading about
Wanna go to lunch?
Michigan